Hi everyone, welcome to 4546. I thought I would do an informal video just to introduce myself and talk a little bit about the course. So my name is Sandra Peniston. You may know me as Sandra Scarrett. I'm in the midst of trying to change my name. I was remarried a couple years back, and so just trying to make that transition. So a little bit about me. I love being a nurse. So I graduated from Queen's University in 1992. So I've been nursing for 28 years. We had a really small group. It was one of the early years of the BSCN program. So there's only about 40 of us that graduated. When I graduated in 1990, there was a recession. And so my first year was spent in long-term care. And what I learned in long-term care that first year really set the groundwork for my whole nursing career. From there, I went to cardiology and then ICU and spent the last 4 years of my RN career in the trauma unit at Sunnybrook. In 2004, I went back to school and graduated from U of T with my Master's of Nursing and my nurse practitioner. And at that time, it was called the acute care nurse practitioner. And I worked as a nurse practitioner in cardiac surgery at Southlake for many years, 2004 until last year. I gave up my position there because I wanted to spend most of my time or all my time in academia. And so I've been at York since 2012. And last year I took a assistant professor tenure track position in global health and primary health care. Super excited to be full-time at York. I love being at York. So a little bit about this course, our course, and why global health is so passionate to me. I've been traveling to northern Ghana for the last 8 years. I've been co-leading a team of nurses in a big group of medical professionals, so dentists, surgeons, nurses, optometrists, pharmacy, just trying to think of all the people that come with us. We have a group of about 60 people that travels to northern Ghana every year for 2 weeks to do outreach, rural visits to groups of individuals that have absolutely no access to healthcare. This is where my social justice piece comes in and my advocating for health for all. It's not fair. It's not fair that these individuals have no access to healthcare. And so what our group has done over the last 10 years is we've been raising money, and we've raised $10 million to start the building of a hospital in northern Ghana. Super excited. And so a lot of my energy now will be focusing on getting this hospital up and running. And we'll be looking for students like yourself and RNs like yourself to come with me to get this hospital running for these fantastic people that live in Ghana. So I'm going to show you a quick picture of me and my husband. My husband comes with me, and here it is. Let's see if I can show it to you. This is last year. The sun's kind of funky. Anyways, this is last year with us in Ghana. So I will bring a lot of my work in Ghana into our coursework. Why do you need to know about global health? Well, to be a 21st century nurse, and just think about the pandemic that we're living in right now, you need to understand global health. So health is a lot more than just working at the bedside. And you've learned this in your community class. But what I'm talking about are the global issues that impact all of us around the world. And it's not just about international health. It's not just about malaria and HIV and child malnutrition. It's about more than that. It's about heart disease. It's the #1 killer. It's about the pandemic that we're living through. It's about climate change. It's about environmental health. It's about malnutrition everywhere around the world. So all these things that we will discuss, it's about human trafficking. It's about the vaping crisis that we're going through. So we will discuss all of these issues as we move through the 12 weeks. So I'm trying to keep this under 4 minutes. And so what I want to draw your attention to is take a look at the syllabus, take a look at the assignments that are going to be required for the course, and do the pre-work module, because it's in the pre-work module that I do a walk through the syllabus. I talk about how to communicate with me, and kind of set you up for what to expect in the next 12 weeks. My office hours are going to be virtual, obviously, so you can email me and we can discuss on the phone. We can talk on the phone. We can talk via Zoom. And also, I'm going to reserve 1 hour a week for us to meet synchronously so we can just keep connected, talk about the course content for the week, talk about any questions you may have, and also maybe there's something really exciting happening in global health that week that we can discuss. So have a great 2 weeks of your summer, the last 2 weeks of your summer. Have a great 2 weeks, and we will touch base and catch up in the beginning of September. See you then. Bye.